In this lesson, you will learn how AI supports treatment planning and clinical decision-making. We will look at clinical decision support systems, AI-powered drug interaction checking, and personalized treatment recommendations. Then we will walk through how AI is actually being used in 3 settings: oncology, chronic disease management, and surgical planning. And we will finish with the part that matters most, the difference between an AI suggestion and a clinical decision. That distinction is not a footnote. It shapes how you use every tool we are about to describe. So keep it in mind as we go through each capability, because the technology is only useful when the responsibility for the decision stays exactly where it belongs. Clinical decision support has existed for decades. Simple rule-based alerts, like check renal function before prescribing metformin, have been in electronic health records for years. What changed is that modern AI-powered systems can analyze far more complex patterns and give more nuanced recommendations. Here is the difference in practice. A rule-based system might alert you that a patient's creatinine is elevated. An AI-powered system looks at the trajectory of that creatinine alongside vital signs, medications, comorbidities, and nursing notes, and predicts that the patient has a 72% probability of developing acute kidney injury within the next 12 hours. Then it suggests specific interventions, same lab value, very different level of insight. Epic, the most widely used electronic health record in the United States, has embedded several AI models directly into the chart. The sepsis prediction model analyzes patient data in real time and generates risk scores for sepsis onset. The deterioration index assigns a score predicting the likelihood of ICU transfer or a rapid response activation. And readmission risk identifies patients at high risk of 30-day readmission before discharge, so teams can target interventions while the patient is still in the building. What makes these models practical is where they live. They run in the background and surface alerts through the record you already use. There is no separate tool to open, no extra login, no parallel workflow. Prescribing is one of the highest risk activities in healthcare, and AI is helping reduce errors. It goes beyond traditional drug-drug interaction databases by weighing patient-specific factors like age, weight, renal and hepatic function, and genetic profile. It considers cumulative medication burden and polypharmacy risk, timing and dosing optimization, and contraindications based on current diagnoses and lab values. AI is also making pharmacogenomics practical. Models can analyze genetic variants affecting drug metabolism, the CYP450 enzymes, and recommend dose adjustments for medications like warfarin, clopidogrel, or certain antidepressants. Pharmacogenomic testing is not routine everywhere yet, but AI automates the complex interpretation of that genetic data and turns it into actionable prescribing recommendations. Cancer treatment is one of the most complex areas of medicine, with multiple specialties, treatment modalities, and evidence that changes fast. AI helps in 3 ways here. For tumor boards, it can summarize the patient's complete cancer history, imaging, pathology, and genomic testing, identify clinical trials the patient may qualify for, analyze the latest evidence for proposed regimens, and compare outcomes data across treatment approaches. In radiation therapy, AI automates the contouring of organs at risk, work that traditionally takes hours of manual effort, cutting planning time from hours to minutes, with accuracy comparable to expert manual contouring in many cases. And in precision oncology, platforms like Tempus and Foundation Medicine use AI to read tumor genomic profiles, find actionable mutations, and match them to targeted therapies. For chronic conditions, AI supports ongoing treatment optimization. Insulin dosing algorithms inside continuous glucose monitors, like Dexcom devices paired with insulin pumps, adjust insulin delivery in real time based on glucose patterns. In heart failure, AI analyzes data from implanted devices and remote monitoring to catch early signs of decompensation, so medications can be adjusted before hospitalization. For hypertension, models read blood pressure patterns from home monitoring and suggest titration of antihypertensives. Surgeons are starting to use AI before the first incision too. It generates detailed 3D models from CT and MRI scans to visualize complex anatomy. Risk calculators like ACS-NS-KIP, enhanced with AI, predict complications more accurately, and AI-enhanced robotic systems offer real-time guidance, identifying critical structures and suggesting instrument positioning. With all of these capabilities, one principle stays absolute. AI provides recommendations, clinicians make decisions. AI does not understand the full context of a patient's life, their values, their goals of care, their social circumstances, or their prior experiences with treatment. A treatment that is statistically optimal may not be right for a particular patient. So treat any AI recommendation as one data point alongside clinical guidelines, patient preferences, and your own professional judgment. Discuss AI-informed options with your patient using shared decision-making principles. Document your reasoning for accepting or deviating from the recommendation. And keep your clinical skills sharp. AI should enhance your capabilities, not let them atrophy. Here is what to carry out of this lesson. Modern AI-powered decision support analyzes complex patterns across many data sources to produce nuanced treatment recommendations. AI strengthens medication safety through advanced interaction checking, dosing optimization, and pharmacogenomic interpretation. In oncology, it supports tumor board preparation, radiation planning, and precision medicine. In chronic disease, it enables real-time treatment adjustments for conditions like diabetes and heart failure, and the core principle holds throughout. AI provides suggestions and data. Clinicians make treatment decisions in partnership with their patients. Now, go try it yourself. Open this lesson on FreeAcademy.ai and use the interactive prompt playground right there on the page, or paste your own scenario into an AI assistant like ChatGPT or Claude and see what it surfaces.